So most of the attendees are dental care providers, dentists. We have some healthcare providers, students and residents. So I will tweak my talk to fit everyone, inshallah.
Yeah, because they call me.
Okay.
Now I have to go.
So first of all, I'd like to give you an idea about my journey in digital health and teledentistry, especially for the students and residents in the room and how I started my journey. So I started with my scholarship when I started the doctorate degree in dental public health and the residency in geriatric dental medicine, but I created a special path for me. So in dental public health, I studied some courses with the School of Public Health about mobile apps and telemedicine, even from another schools. So this is some of the projects that I'd like to share with you. One of the project was about mHealth app that we developed within a team to address the depression screening and for patients in Chiapas, Mexico. Another project was the first entry for me to the telemedicine and teledentistry world. And this is about telemedicine. It was about engaging health providers in remote areas to use the technology of telemedicine to provide these remote services and healthcare services to patients who live far away. So there was some resistance by the doctors, and within a team, we worked on strategies to improve the engagement of the doctors with the telemedicine technology. Why I'm saying all of that? So I started my journey by the telemedicine and learning. I took some courses, I joined some conferences in telemedicine, and from there I take it to the teledentistry, including a hackathon that I participated in, and we won in that hackathon with the teledentistry project. With another colleague also from Umm Al-Qura University. Then I got involved in the American Association of Mobile and Teledentistry Alliance. And from there, I got involved a lot with the teledentistry, and I'm gonna walk you through in my presentation. You can find the video of these projects also in the YouTube if you search my name. So this is kind of a glimpse of my journey for all the students and residents in the room. You can create your own path and you can study your passion and make it your dissertation. So my dissertation was about mobile apps, and this is where I presented in one of the conferences. So just a disclosure at the beginning that any projects that I will mention, any kind of apps, it's just for the sake of the examples. I don't endorse any of these products. So just to make this clear at the beginning. So what is the origin of teledentistry? It's kind of an early concept that started in around 1994. So this was the first trial of teledentistry in the army. So there was like 15 soldiers that went to get a periodontal surgery. And after the surgery, a general practitioner saw them to remove the sutures. And it was very helpful. So the 15 soldiers that saw general practitioner, only one of them returned to the specialist for the periodontal surgery follow-up. So it saves the time and it saves the travel for these soldiers, especially it's, you know, the times of crisis. So this is where it started, the teledentistry. So at the beginning, I would like to define what is teledentistry. Teledentistry is the use of information technology, electronic information, imaging, and telecommunication. This can include audio, video, data communication as well as store and forward technologies. And usually it's used for dental care, consultation, and education. So Dr. Aura, could you please record the session?
It is recording, so go ahead.
Okay. So this is the definition of teledentistry. It's the use of information technology and telecommunication, as I mentioned, and it has so many modalities. So I'll be discussing these 4 modalities. It could be synchronous, asynchronous, remote patient monitoring, mobile healthcare services. So the first one is the synchronous teledentistry, which is, as you see in this picture, it's about real-time interactive technology between two health providers. Here in the photo, you can see a dental hygienist who is taking the photos of a child, of his teeth. And in the screen, you can see a pediatric dentist who are guiding this dental hygienist and giving a consultation about the status of the teeth for this child. This is from a Finger Lake Community Health Center in New York. The other modality is asynchronous teledentistry, and that means storing and forward of information. How this is different, it's not live, so it's a dental practitioner or non-dental practitioner who can use the camera to take the photos of the teeth for the child, and then can store these photos in a secure system, and this can transfer to a dental professional who can read these photos in another time, in a different time. Here in this photo, this is in a daycare center. So she's not a dental professional or hygienist. So they can be trained maybe in models or something to deliver this kind of services. And this is, again, it's called store and forward. Okay. Another terminology that I want you to know, it's originating and distant site. So this is used commonly in teledentistry. What does that mean? So originating site is the location of the patient. So for example, we have a multiple of primary health centers, could be in remote areas, and this is where the patients are. And then at those centers, maybe a dental hygienist or a dentist who can take these photos and collect all this information and then send it through a secure platform to a dentist in another area, or to a specialist and consultant to have the consultation. So as you see here, the spokes are the primary health centers where the patients are located, and the hubs are the specialized center, which is the distance where the specialist is located to provide these consultation via teledentistry. So these are some of the images are taken by the teledentistry, as you see, and these are not taken by a dentist or any dental professional. This is a regular nurse who's taking these photos, and you can see if they are trained a little bit, they can take a very nice photos. And all the studies mentioned that the diagnostic information obtained, like most of the studies, that these kind of photos have a very good diagnostic information, and they are similar to the real-time assessment information obtained by clinical diagnosis. But just note that this varied a lot according to the device that you are using for the teledentistry. Some of the professionals are using the phone camera of the mobile, and some are using the intraoral camera, and others are using a very advanced one, which is the caries detection camera. And there is also the digital camera that you also can use in the teledentistry. So it's variable from equipment to equipment. Okay. So another type of the teledentistry, we have a remote patient monitoring. This is not that common in the dental field, but to simplify it, it's about connected tool that record the oral health. So it can be like the connected toothbrush, as you see. When you have now, especially the advanced connected toothbrushes, it can connect the areas, the times, the duration, all of that, and then you can send it like to your dentist, or maybe as well to the parents for their children. When I was in my residency in geriatric dental medicine, we used to prescribe the electronic toothbrushes to the older adults because it's much easier for them. But we didn't get the chance to try the features of kind of the tracking the patient data. The other equipment and the other tool is as the video here that I will show you in a minute.
Technology making it all possible. Thanks to our remote dentistry solutions, patients now have access to their dental professionals whenever they need it, providing convenience, flexibility, and peace of mind. With our easy-to-complete scanning process and our DM scan box, treatment appointments can take place at any time, anywhere. And with inherent features like one-to-one messaging, photos, and video chat, dental monitoring is keeping patients and dental professionals connected remotely. Ready to start?
Okay. So as you see here, this is another tool, and it's really helpful for the orthodontic specialities, especially the aligners. Invisalign, I mean. Okay. The fourth modality of teledentistry, which is the mobile healthcare services, which has a smartphone apps and text messaging, and these usually are used to deliver the health information to the public and to the community. The definition of teledentistry varied by space and country. So in the US, they have many definitions for it, but in France, they have it more as a diagnostic, usually by using a caries detection camera. So I'll show you that in a minute for the, okay. So let's see now about the applications. And before that, I'd like to have another poll question. If we may, Dr. Adwa.
Yes, sure.
And I want to make sure that is everyone following me, or I'm talking so fast?
You
Right.
can read the chat too. Yeah, you can write in the chat. Dr. Ala, which poll? The second
The
set?
poll for the applications, if they know the
Okay.
applications or not.
Okay.
Okay, we can. I think we're ready. Yes. Yeah, we can share the.
Yeah.
Right now.
Okay.
It's almost the same. So half of you know the application and half don't. So I'll walk you through the applications and we'll see if teledentistry can be applied in different dental specialities. Okay. So the applications of teledentistry could be medical dental, so it can integrate them together, clinical collaboration, education and training, and public health. So medical dental, just to give you some kind of idea of my program in the geriatric dental medicine, we have a geriatric home care program. So we, my fellows and I go in a home visit to see older adults in their home and provide dental care services that include dentures, hygiene, cleanings, and sometimes simple fillings and extraction. So for the geriatric home care, we work closely together with the medical team of the Boston Medical Center. And in that kind of work collaboration, sometimes for the medical team, as you see in the first picture, this is a medical professional, a healthcare provider. When they saw something that needs the attention of the dentist, they take a photo of it and then talk with the dental faculty in the geriatric residency. So it was used lightly, the teledentistry, at the beginning of my residency, just like for consultations, second opinion, about the different kind of findings in the medical rotations as well. And from there, we take it, either we go and see the patient or we refer the patients directly to see a surgeon for extraction or something like that. Then when, and as you see here in the picture, this is from one of the visits. We have mostly the older adults, they have like disabilities, so they can't go to the dental, to seek dental care in the hospital. And usually teledentistry, I have a plan at the beginning of the residency to help facilitate the visits to see the patients, especially if we don't know what is the problem of the patients. Sometimes we carry so many instruments, and then at the end we find out that the situation is different, that we don't need all these instruments for dentures and the patient has something else or another complaint. So if we implemented teledentistry in this kind of scenario, it helps a lot in allocation of the resources. And if we want to think about Saudi Arabia, it could be very helpful in mobile dental clinic as well, or with working with the medical teams. So when the pandemic hits, we, in the geriatric dentistry, the residency started to apply emergency triage. And the school has this kind of policy for teledentistry. So it has been used just for emergency, and especially that we are working with different nursing homes. And in nursing homes, the communication is mostly between the dentist and the nurses in the place. And as you know, with the pandemic, most of the nursing homes has been closed, and we have many restrictions that to limit the number of employees in one space. So for the dental clinic in the nursing home, we have one over there. They want only one dental professional in the place. So it was so difficult to see the patients. And so the faculty started to use teledentistry to do the triage. So the nurse was communicating the cases with the dentist to see which case is emergency and which is urgent. And there was a guidelines from the ADA about that. So what we used at the time was the platform Zoom HIPAA, which was very secure. So what about other dental specialties and how teledentistry has been used in these specialties? In the literature, it said for periodontics, as I mentioned earlier, that it started with the army. So it's mostly used for the follow-up visits. So the patient don't need to go back to the surgeon to have their visits. So it cuts the number of visits. So the follow-up could be just remotely. Pediatric dentistry that could be used like screening children for early childhood caries. Prosthodontics, that's very important, like also in education. For example, general dentists living in remote areas can have some instructions from the consultants in the main city, like how to construct an overdentures for some of the patients. Endodontics as well. It's really helpful to diagnose the periapical lesions, remote recognition of root canal orifices, and oral surgery as also for the follow-up of the surgery appointments and teleconsultation. Usually for the surgery, it's before the surgery, we have like the preoperative health assessment. And this is very efficient to have it done by teledentistry through either live video conferencing with a consultant or also along with the store and forward to send the photos to them. For orthodontic as well and patient education, as you know, in orthodontic patients, there's a lot of kind of emergency that's raised from the wires or from the braces itself. So it's really helpful to have this immediate kind of consultation with the orthodontic patients. Teledentistry has been used also in oral medicine for distance screening and referrals of patients with any oral mucosal lesions. And we have like many cases, especially like in nursing home and older adults, it's common to find the oral lesions, and you know, it's so difficult for them sometimes to go to the hospital to seek care or to have their annual dental exam. So on the left, we have, this is one of our patients, and we just found this lesion in her mouth. Usually in nursing home, the first day they admitted, they should go to the dental clinic, since we have a dental clinic inside the nursing home, to get the examination. And when we saw that, it shows that maybe no one has noticed the lesion in her mouth before. And it ended up that she has a squamous cell carcinoma. So teledentistry could be very helpful in early detection of lesions if it was done like for the older adults in their homes or in their places. As you see in the right, this is also oral medicine consultation remotely done. And usually in these places, this is in Australia, where they have also standardized kind of form to record the findings and then send it to the consultant. So just to have like 10 seconds of stretch before going to the examples of the programs that apply teledentistry. And please let me know in the chat if there is any kind of clarification you want me to, any questions that you have before moving to the second part.
Do you want to do the poll again, because we had a lot of people came after?
Yes.
Should we do the first and the second one, the country and the other one?
Okay.
Yeah.
Okay, I think we are ready to share the results. It's interesting.
Okay.
We have 77% almost from Saudi, and we have some from the USA, some from Germany, and others. I can't see the chat. Okay.
Yeah.
From which country? The others?
There's UK. I want to make sure about why teledentistry is not applied in the UK.
It's applied in the UK. I found one of the applications in the UK. Ask me that.
And then the countries were Sudan. There's someone from Sudan.
All of you are welcome. Thank you so much for joining us. Egypt.
Egypt as well.
I see questions. How accurate is the diagnosis through teledentistry? And if there are any studies done? Yes, there are many studies that has been done like on teledentistry. There's also systematic review. It's kind of acceptable to a good kind of diagnosis about like the moderate to high. Sometimes, as I mentioned in the beginning, it depends on the equipment, but for the reviews, I can share the reviews later. The reviews mentioned that it has a moderate to high agreement in regard of the teledentistry and diagnosis.
Do you want to share the career one as well? Just to,
yes.
I'll do it again, just while we're waiting.
Sure. Okay. The other question with my here. And the problem in the study is like that study diagnosis, like the early reviews, it was so heterogeneous in the way they are taking the photos and the type of the equipment. But there's a very recent one, a recent study that just published in January 2020 about the caries detection cameras. And it was an acceptable diagnostic findings in that study. Okay. Awesome. So let's move on. And now I'll explain more and give examples of the teledentistry program. Okay. So the first program that I'd like to mention, it's about, this is in New York State. And this is between the Eastman Institute of Oral Health, University of Rochester, and the Finger Lakes Community Health Center. So the community health doesn't have any pediatric dentist. And usually when they saw like the patients, the children, they needed to go to the OR to get their treatment done. But most of the patients don't go to the specialty center in the University of Rochester to get the treatment because of the travel burden for the families, and also the language barriers for them, as we've seen them up. So they started to implement teledentistry, and interestingly enough that they learned from the telemedicine, as telemedicine was applied also in that place. And from teledentistry, they started in 2007. Until now, it was really positive. So I want to show you a video first to see how the teledentistry was applied in this program. And thanks to the director of the program for sending me this video.
Those are pretty cool ones you picked out there, Mr. Jason.
Yeah, I have a whole master bag with a whole ton of them.
So this is a dental hygienist.
There's a little the mesial decay on G.
Yeah.
Doing the
You're doing
preoperative
excellent.
visit.
buddy. Thank you so much. Open really big. We're almost done already because you are so good at this.
And you see
It
how
looks
the
like it has
child
a-
is so cooperative.
Resin on L.
Yeah, it looks like it has a resin. Yeah.
That was really cool, getting a close-up shot of all of his, I like to call them teeth bugs and issues that are in there. And the dentist in Rochester was seeing it at the same time. And since that was pretty much an online consultation, we can go right to Rochester and get the work done. We don't have to go there, have a consult, leave again, and then come back for the work.
So Pat will help set up everything with you there, Mom, okay? To help coordinate the appointments and scheduling and everything like that.
Yes.
Okay?
All right, well, we'll see you later. We'll see you next time in Rochester. How's that sound? Sounds like a lot of fun. Perfect. Thank you. Bye.
As you see, the parents were very happy and the child was so cooperative. And actually, this has helped a lot in cutting the waiting list for the to get the treatment from 6 to 8 months to 8 weeks only. And it helps a lot. So they have only one travel to get the treatment under general anesthesia, and then a recall visit in the Finger Lakes Community Health Center to get like a fluoride varnish, like after 3 months of that. And this is also the code here if you want to have a glimpse at the paper. Okay. As you see here, since the beginning of this program, more than 850 rural children have been served via teledentistry. And the completion rate when they started at the beginning, before teledentistry, was 15% that the children complete their treatment. But after the implementation of teledentistry, it raised up to 95% who completed the dental treatment. So it was really efficient for them. The other example is from France, from Europe, the Hospital Center University of Montpellier. So this is an e-dent. It started as a project in 2014. It has been like 6 years now. It's now a program that is between, it depends on asynchronous. As you see in the previous example was mostly real time, but this one is asynchronous, and it's between the nurses and the dentists at the university. I'm gonna show you a video now about this. It's in French, but I'm going to explain.
Dans cette maison de retraite d'Uzès, une infirmière spécialisée se rend 2 fois par semaine auprès des résidents.
Okay. So here's the nurse. She's in a nursing, this is a nursing home, and the program was used mostly for to see the older adults or patients with chronic diseases, patients with disabilities. So the nurses first visit and give like a hygiene, oral hygiene to the patients, and then start to collect the data using the intraoral camera. And here nurses are trained to take the photos of the teeth. As you see here in the video. And they send all this information, like through the platform, to the dentist and the University of Rochester. So this is the second step with this transmission through a secure platform. As you see here, the nurse is using the intraoral camera to have like a full video of the mouth. So there's no need for the older adults to travel like to the hospital to get this done. And usually this program, like since they started, they are giving, providing 13 to 15 teleconsultation per week. Okay. So it's very comfortable for the patient because it's in their living environment, in nursing home, or it could be in the home itself. And it's so familiar for them. They know the practitioners around them. And it's also help them to avoid any unnecessary trips, like to the dental appointments. Okay, so, and here the third step is like to provide a diagnosis after the dentist review the video. And here you see the doctor with the students as well. So it's also an opportunity for them to learn like about teledentistry. And after the diagnosis, they provide a report to the patient. Okay. So as I mentioned, it's really in this program, it's improved the efficiency of care, the quality of diagnosis to address the patient needs and the general health status of the patient. It's also increased the patient's comfort and convenience, and also the quality of life, since it provides an annual checkup for the older adults and the patients with disabilities. So it helps in early detection of any dental caries. And also one of the benefits and impact of this program is the knowledge transfer, like between the nurse and the dentist as well, if they needed any consultations for the patients. And it helps a lot in sustaining the care coordination and the organizations. So another program, it's from Australia, and this is one of the projects that they're working on. It's ongoing. So this is a published research protocol. They already finished collecting the data of 150 children. And in Australia, it's a different model. So it's a dental therapist who go to the schools to see the children. And usually the dental therapist can do many things, can like fillings, hygiene, can do extraction, but up to the age of 18 years old. And after the age of 18, there should be a supervision by the dentist. So in this program, they go to the schools, and also after having a training on how to use, in this case, they use the mobile phone to take the photos of young children. So here it should be protected like by username and password for the patient's security, the information security, as you see. And then they are taking photos, 5 sets of photos for the teeth of the children. As you see here in the second picture, this is the full set of the teeth. They are taking this for each child, and it's very easy for the children than the adults to take photos with the phone camera, with the mobile phone. As you see, they are taking upper occlusal, lower occlusal, right lateral, left lateral, and also frontal. And they can fill also the chart. So they have an interactive kind of chart to fill this out at the school. And then they can put the recommendations for the parents as well as for the dentist and what they saw already. And this is transfer all in the secure platform. As you see here, this is more of a store and forward. As I mentioned earlier, it's asynchronous. There's no video conferencing. Here, the school children, and a mobile app was used to take the dental images from the children's mouth. Dental images transmitted to a secure server directly from the mobile app, and then this can be viewed from a web app by the dental practitioners later. So for this program, they had a training before, and there should be training in any teledentistry program because you want a standardized kind of photos at the end that is really helpful in the diagnosis. So they got like a 5 to 10 hands-on training, and then they tried on 20 volunteers. Then they have like in total 2-3 weeks of training to have this all done. There is also another model that is called virtual dental home. And the first concept has raised by Professor Glassman like a decade ago. And this is usually it's by a trained dental hygienist and assistant who goes to the community, like a community-based program. So they go to the schools, they go to nursing homes, they go to these places, to the underserved, where they can find the underserved population, and they provide preventive and hygiene treatment. And this is usually by the teledentistry. So they also collect the data from the population and send it to the dentist through a secure teledentistry platform. And through that, the dentist will review all the data and then develop a treatment plan for the children at the schools in the virtual dental home. And in this model, usually the trained, like the dental hygienists and assistants that go into the community, they have all the instruments that they need. Even they have a portable X-ray machine to take the X-ray machine along with the photos and then send all of that to the dentist. And then under the supervision of the dentist, they can even provide a simple filling or like to the population. So this is an example in Colorado virtual dental home. And since the start of this program, more than 10,000 dental visits has been undertaken in 12 counties, in which 10% of them had never obtained such care. Okay. So what about teledentistry applications during COVID? As you know, with COVID, there was like many restrictions, the social distancing, and at the beginning is also the lockdown, where many places has been affected by that. So this is another like an example of the application of teledentistry during COVID by a private dental clinical practice in the US. Dr. Nathan Suter has tried different kind of modalities and application of this, of teledentistry. And this is an example of these applications. So first of all, he started to apply teledentistry to do a limited evaluation and triage. Since the lockdown and no one can go to the dental clinic, either the provider or the patient, he provided that using different platforms. As you know, at the beginning, there was a relaxation in the platforms. So the dentist can use Zoom or like a Google Voice message and all of that. So this was at the beginning, but policies has changed and it's not advised to use like these platforms. There's more secure options right now. The other application, so in the limited evaluation and triage, it was mostly to address the complaints of the patients. And following the ADA guidelines of which one is emergency and which one is urgent, the follow-up visit depends on that. The second application is the hygiene assessment. So when the clinic reopened after the lockdown, he's separate. Someone is talking. Yeah. So after reopening the clinic, he separated the teams into two different teams, the hygiene assessment team and the dentist assessment team, the treatment team, just to reduce the number of employees in the place. So in the hygiene assessment place, there was only the dental hygienist in the clinic, can run the examination and collect all the data that needed and then send it to the dentist. So there is no need to have a contact between the employees, just to minimize the exposure. Because if one gets exposed, everyone gets exposed to the infection, then they will need to lock down, to close the practice again. So I will show you now an example of separation of the teams and how this was very helpful in minimizing the exposure. The third kind of application is the community outreach. It's also by using teledentistry to schools and nursing homes, as we mentioned in the previous programs. And the last one is the specialist consultations. If there is a need for a specialist consultations, for example, orthodontics or pediatrics, they can use it as well using a teledentistry, either synchronous or asynchronous, as I'll show you here. So this is the schedule that the clinic has implemented. And as you see, the dentist has separated the teams into hygiene assessment team and treatment team. Just each one is in a different days, just to minimize the exposure. And they see both the asynchronous and synchronous consultation. So it's really helpful even to eliminate the usages of the PPE, since there was a problem in getting enough PPE for the clinics. It helps also in reducing the number of employees in the facility and ease of communication and patient convenience. So as you see, the programs have implemented teledentistry in a very different approaches. and use different equipments, range from a mobile phone to intraoral camera to even a caries detection caries camera. In France, they usually use the caries detection camera because it's more diagnostic for the patients. But you have to know that there should be a considerations before implementing any teledentistry program that include the assessment and needs assessment and where is the need, because you have to see what is the context. Do you have the right equipment and the technology that will help you implement teledentistry or not? And I encourage the people here to see what's the option are. For example, at Al-Qura University, when we ask here and see the other colleges, they already implemented telemedicine and they have the right kind of platforms and secure platforms to provide telemedicine consultation. So another thing that you should consider as well is the behavioral and how is the attitude of the patients. Will they accept the teledentistry consultations or not? And legality and ethical kind of matter as well. It's so important. And also the training, which is very important in teledentistry. The team should be trained like how to use the camera, how to have everything standardized. And then the documentation, as teledentistry needs a special kind of note documentation, as documenting the originating site and the distant site, and documenting which methodology that you used. For example, did you use the video conferencing, or did you use the store and forward? You just take a photos and then you will send it later to the dentist. And most importantly, also the follow-up care. So after you deliver the teledentistry consultation, you should, after that, indicate which place that you are referring the patient to. So you should have the resources as well. You want to refer it for general anesthesia, so indicate the places, or a private clinic. So you have to indicate all the places, and you have to have these before starting the teledentistry implementation in a place. Okay. And this takes us to the end. Teledentistry has many implementation, can range also to maybe teletreatment in the future, but doesn't mean that this will replace the dentist. It does mean it will expand the dental care in the dental field.